Hey there, this is Kester from Active Health Clinic, and I thought I would just put a short video together talking about the benefits of isometric exercises for people with hypermobility especially, but also anyone that's experiencing fatigue syndromes, chronic pain, which do happen to be a lot of hypermobile people, but these can be beneficial in different ways for people that don't have that problem. I'll just lay some groundwork in terms of like what an isometric exercise is. Essentially, isometric meaning that it's not dynamic, so you're not moving. You're really just holding a position for a set amount of time, and that's called like an isometric muscle contraction. So you're not, I guess moving, but your muscles are still active, but you're more just holding a position rather than flexing and extending, perhaps for like a, in terms of a bicep curl or a knee extension. The reason why these can be really helpful is that specifically for the tendons, for people that are experiencing tendinopathy, tendonitis is another phrase that gets used, and the itis meaning inflammation, and tendinopathy just meaning like pathology with the tendon itself. Like, I guess tendinopathy is more of like a all-encompassing phrase that describes issues with someone's tendon. But these exercises are specifically good for this, so people who are experiencing tendon injuries, because it's a way of putting a stimulus on obviously the muscle, but also the tendon itself in a way that doesn't tend to flare up the tendon and make the inflammation or the kind of collagen degeneration that can occur when it comes to tendinopathy. The good thing about isometric exercises is that because they're not a dynamic exercise, you're just holding a position, generally they're maybe seen as safer because there's maybe less room for error and injury, and for people that have hypermobility spectrum disorder or Ehlers-Danlos or just hypermobility in general, and maybe more prone to instability or injury because of that more elastic connective tissue. So this is a really great beginner exercise for people. Isometrics are often prescribed a lot for people with just injuries and part of their rehab. But what we know about fatigue syndromes and pain syndromes, it's really important that we figure out an exercise dose that isn't going to flare that person's symptoms up, and isometrics can be a good place to start for people. The other good thing about it is it does have a kind of quite immediate, or like once you've ceased the exercise, it does have a pain inhibitory effect, so you're going to get some relief potentially if you do have tendinopathy and tendon pain, which is really helpful. Sometimes when you're doing the exercise itself, it may be a little bit uncomfortable. I wouldn't be exercising through really excruciating pain, especially if that pain is getting worse throughout that exercise or throughout the movement. But yeah, it can be a really good place to start, and we can do this for lots of different joints in our body to kind of exercise the tendons. I guess the reason why, and potentially there's going to be people that have specifically issues with tendon issues as part of their hypermobility. That's because tendons are made of collagen, that's connective tissue, so probably more prone to that degeneration and elastic tissue, when really we want tendons to be quite stiff and strong because they're transmitting the force from our muscles. Like going back to the different exercises, you can choose, there's all different joints in the body. You can find a way to engage with an isometric contraction. A really typical one for patella tendon pain would be a wall sit, or like an isometric lunge or an isometric knee extension. And you're really just trying to find an amount of time that isn't going to, I guess, flare the pain or be too uncomfortable. Like I said, maybe a little bit of discomfort, if not progressing worse, and definitely not worse after the exercise. Really, the tendon soreness should improve with rest after your exercise. If it's really ongoing, you've probably maybe overdone it a little bit. But just starting from anywhere between like 10 to 30 seconds and working your way up in duration of those holds, and then slowly adding resistance. So if you were to start with a wall sit, you could sit maybe higher up on the wall so you're not as deep in it, and then you could work your way down. You could add seconds, you could eventually add weight to increase the resistance there. You can do it for your elbows. I've had elbow tendinopathy before, and I've just done isometric wrist flexion, so just holding weights in that position for 30 seconds to 45 seconds for a few sets. In terms of the specific prescription, I would book in to see a physio or an EP to get some guidance around that. The other side with to consider potentially with isometrics is they do have an acute hypertensive effect. They are actually prescribed for people with high blood pressure because following that acute hypertensive effect, they get a rebound hypotensive, so their blood pressure drops. And so as long as someone's blood pressure is being managed and it's not uncontrollably high, and then we're not worried about the acute impacts of that exercise, people are often prescribed isometrics for their hypertension, and they're really effective for that. But I guess for people with low blood pressure, and which is a lot of people with hypermobility, that exercise itself is probably a good way to get that like immediate slight increase in blood pressure. Really important to breathe throughout while you're doing it. Don't hold your breath, because we want to try and maintain blood flow as much as possible. But just something to consider there. Cool, thanks for watching.